Right, hello. So I'm going to be talking about shock in this PowerPoint. So there's a lot of different types of shock. Okay, so for this one, we're going to talk about more of body reactions, not of like bad news or get electrocuted or so forth. Okay, so shock results in hypoperfusion to the cells of the body that cause the organs and then organ systems to fail. Unless treated successfully, the process will result in death. Okay. So perfusion is the cardiovascular system's circulation of blood and oxygen to all cells in different tissues and organs in the body. Okay, so how efficiently can the cardiovascular system pump blood to everything? And if it can't, then that hypoperfusion, is shock. All right, signs and symptoms of shock. Okay, possible because every shock's gonna be a little different, and everyone will experience roughly a little different things. Okay, weak and rapid pulse, pale, moist, cool, clammy skin, increased and shallow respirations, diaphoresis or diaphoretic, which is excessive perspiration or excessive sweating, agitation and restlessness, nausea, vomiting, hypotension, which is a decreased blood pulse, it means decreased blood pressure, excuse me, confusion, incontinence. Incontinence is losing control of all your bodily fluids, um, everything, urine, bowels, vomit, everything. Dilated pupils, coma, and death. All right, types of shock. Okay, there's hypovolemic, which is due to fluid loss or plasma loss. Some causes include hemorrhage, so like bleeding, for example. Dehydration. This is more of the extreme dehydration, not like, oh, I'm a little thirsty, like, oh, I haven't drank for like a day or two. Diabetic coma and burns. Burns take up a lot of your plasma fluid. Next is neurogenic shock. Okay, so loss of sympathetic control of the blood vessels leading to vasodilation. So involuntary muscles located within the blood vessels walls usually contract while the person changes position from like sitting to standing up. Um, so like let's say you stand up too quickly and you get really lightheaded. Well, that is a small form of neurogenic shock. Another one is an injury to the brain and spinal cord prevents the sympathetic nervous system from sending signals to vasoconstrict. So when you see vasoconstriction, vasodilation, we're talking to your blood vessels. Okay, so vasoconstriction is your blood vessel, which is like an artery or vein. Go from this is vasoconstriction, gets smaller, and vasodilation gets bigger. Now, this is really, really important because it constantly constricts and expands due to the need of blood for exercise, standing, sitting, digestion, whatever. And your body just kind of changes the dilation of these blood vessels depending on whatever it needs. Whether it's limiting blood flow to one area and expanding it in others. For example, after you eat, you have more blood flow to your stomach and your internal organs for digestion. Versus when you're doing activity, your body kind of suppresses that digestion, kind of limits more blood flow. It doesn't need as much to your stomach, and puts more blood flow to your muscles. Okay, so even like a doubling of that blood vessel from like here to there increases blood flow by about 16 times. It's a pretty significant change. Next one is vasovagal shock, okay, also called psogenic shock, which is the common fate, like scared, surprised, whatever it is. This is like a widespread vasodilation and bradycardia. Bradycardia is a slow pulse, okay, usually lower than I believe is 60 beats per minute. All right, next is we have cardiogenic shock, which is caused by inadequate heart function. Decreased stroke volume, decreased cardiac output from a number of different reasons from cardiogenic shock, and this could be of ventricular fibrillation, any kind of abnormal heart rhythm, heart attack, anything along those lines. Next, we have diabetic shock, which is a hypoglycemia, also called insulin shock, in a way. Your blood sugar gets too low. Either too low blood sugar or too high insulin in your bloodstream. Next one is to be septic shock, which is a severe infection, usually bacterial. Toxins released due to vasodilation, decreased oxygen transportation. Okay, in septic shock. Next is respiratory shock. Impaired breathing cause impaired oxygen exchange in the lungs, pneumothorax, or injury to the respiratory control center. Pneumothorax is some kind of puncture to like the wall of the lung or the kind of pleural lining, which can cause a lot of things like stabbing, being shot, anything like along those lines. Next is anaphylactic shock. This is a more common one that people know it as. And this is a severe allergic reaction that be caused by an insect sting, inhaled, ingested substance, exercise, injected medications, toxin, whatever it is, can bring this on. There's a lot out there. Nuts is a big one, like peanuts. Bee stings is another one. A lot of berries, melons, pollens can also bring on anaphylactic shock. So this is more like a system-wide reaction to your body to where your throat closes up and you can't breathe. You like suffocate on air, if you will, just because of that allergic reaction. So this is where you're going to need like an EpiPen or an epinephrine pen to where, right here. So you need like EpiPen like right here. Okay, so this is the EpiPen trainer. Okay, so a lot of them look very similar to this. Okay, so you're going to grab it like this. Don't put your thumb on the end. Okay. And then people that have anaphylaxis will be prescribed a few of these. Okay, so you're going to hold it like this. You're going to pull off the blue cap, okay, on the end. And then you're going to stab this in your outer thigh. And you're going to hold it for 10 seconds. Okay. After that, you're going to massage that area to try and release the toxins. And then you immediately call 911. Because this doesn't last very long. Maybe about 15 minutes, give or take. Okay, so there will be a needle in this. I mean, this is a trainer, so there's no needle. But once that is injected, okay, that needle, so once it's kind of stabbed through, that needle will inject out to release that medication. So leave it in there that full 10 seconds for that. Replace the cap. So this will open up their airway. That way they can like possibly start breathing again, hopefully. Trying to think. Make sure you call 911 because again, you may need to give them a second dosage before the ambulance gets there if like you're secluded or far away from EMS, whatever it is. Don't just go back to your normal day, okay? Because whatever the inhaled, ingested, whatever toxin, whatever it was, can still come back and trigger it again. Okay. EMS will most likely take the EpiPen with them after it's been used to make sure like everything was used out of it and so forth. There is adult and child dosage pens, and it will say on it if it's a child or adult dose. So signs and symptoms of anaphylactic is going to be flushed skin, itching, burning, difficulty speaking due to laryngeal edema, and bronchial spasms in your lungs, tightness in the chest, dyspnea, which is obviously difficulty labor breathing, wheezing, chest pain, hypotension, nausea, vomiting, dizziness, syncope, which is loss of consciousness, coma, and death. All right, so shock management. So this varies a lot depending on the type of shock. Just know this. So it's not going to account for everything. Okay, so obviously you may not need to put them in this recovery position for like anaphylaxis. You could, by all means, but your best treatment is going to be EpiPen. Okay. Okay, so first you want to maintain body temperature as close to normal as possible. Okay, so blankets, pillows, maybe get them in or out of that environment, whatever they're in. Because you want to make sure their body temperature is still like up pretty high. If it's too low, everything just happens slower. You want their metabolism to still kind of kick in. Elevate the feet 8 to 12 feet off the ground. or significantly off the ground. That way it puts all of that blood flow in your lower body. Gravity just takes it back up to the head. Okay. Very, very important to do. I hate how every picture always has like pillows or blankets. You need a lot of pillows and blankets to prop it up like a foot plus off the ground. I'll get something hard. I'll get a chair. I'll have someone stand up and hold their legs. Whatever I have to do to get it considerably off the ground for gravity to kind of bring that all the way back up there. Okay. Keep the person calm and warm. Okay. Calm is very, very important. Okay. If they're in shock because of, let's say, an injury, okay, try to avoid them looking at it because that can just make things worse. For example, I had dealing with a volleyball athlete that dislocated her patella, her kneecap, and she was going into shock. So I didn't let her look at it. I covered it with my hand and a towel. And I told her what happened, like, hey, you hurt your knee, it's dislocated. Because I'm not going to lie to her, but I'll tell her what's going on, but I don't want to look at it. Because a lot of people freak out. Like, all our teammates freaked out seeing it from the sidelines. And so I moved them out of the way. Coach, move them out. Because they're not helping the situation. Okay? Obviously, if having them avoid viewing it doesn't take precedence over saving their life. Just know that. But let's say they're just kind of like hyperventilating because of like the injury or whatever. Just kind of like, hey, don't look at it. Like, look at me kind of thing. Give nothing by mouth. That's important because let's say they have to do surgery for whatever reason. Now they have to pump their stomach, which is like surgery complication. So the SX, is shorthand for surgery. Insulin shock, they're going to need sugar. So that one's, you could give them something by mouth if they're conscious. Okay. Next you want to do is, if you can, take their vitals. Pulse, blood pressure are the big ones. Also level of consciousness, which is the Glasgow Coma Scale, which depending on the semester we will not cover in person. Medications, obviously EpiPen, I talked about that. CPR. Be ready to do CPR if needed, wherever it is. Okay. Pulse can be rapid, weak. Respirations could be rapid and shallow. Okay. Whether it's just giving respirations because they do have a pulse, or whatever happens with a shock and they now they have no pulse and no breathing. Okay, so that could be a possibility. So maybe that, hey, you have someone that's just kind of standing around there. Hey, go get me the AED. Okay, I mean, you just have it there. Doesn't mean you have to use it. Okay, but just have it there. All right, a few scenarios. Scenario 1. A female athlete has been having a heavy menstrual bleed over the past week. She is lightheaded, weak, pale, and clammy. What type of shock is this, and how do you treat her? Now, I'm not going to give you the answers to this. You got to go back in this PowerPoint and kind of look and identify this. But all these are real scenarios that I've come across. Okay. So a female athlete has been having a heavy menstrual bleed over the past week. She is lightheaded, weak, pale, and clammy. What type of shock? And then how do you treat it? Scenario 2. A spectator stands up after hours of watching tennis and is severely lightheaded. He immediately falls over, hitting his head against a curb, resulting in a laceration across his forehead. He only opens his eyes when spoken to, talks in kind of a confusing tone and words, but he is obeying commands. His laceration is bleeding profusely. Okay. What type of shock is this, and what first aid do you perform on him? Given depending on the class and situation, I may or may not have the first aid before or after this. But just think, what would you do? Okay, if I haven't covered the first aid yet, and don't say just call 911. Okay, I want more of that. 3, you scare a coworker and she faints. Obviously, I've never seen this because I've never seen someone faint from being scared. So what type of shock is this, and what treatment do you do? Keep in mind, you scare her and she faints. If she is standing up and she falls, how did she land? Did she hit her head? Did you catch her? What happened? So that's always kind of a complication of stuff like this. Scenario 4. You are called out to a person who is not feeling well. You find an elderly lady who is having a hard time breathing. Her general appearance is not well due to labored breathing, yellow-colored eyes, and fingernails. What type of shock is this? Scenario 5. An official calls you over because he isn't feeling well. He is sweating profusely, seeing double, has a headache, hasn't eaten in the last 4 hours because of a tournament. He says he usually gets like this when he doesn't eat. What type of shock and what treatment do you do? So obviously go back, trying to figure out what type of shock it is. I think I have like 7 different types of shock in here. And just try and think outside the box a little bit. Okay. Like what's normally going to happen. Okay. Given I know a lot of you guys don't have a lot of experience in a lot of different like real life things that happen. But think of like, let me see, go back to 2. Okay. Spectator stands up after hours watching tennis, feeling lightheaded, falls over, immediately hits his head in the curb, resulting in laceration in his head. Okay, for example, this was a grandparent. Okay. What kind of meds is your grandparents on? Okay. In this case, this guy was on blood thinners. Okay. And if you're a blood thinner and you've got a cut, you bleed like crazy. Okay. So you got to keep other things in mind that you may not be expecting. Oh, it's a simple laceration. But if he's on blood thinning meds, well, he doesn't really clot very easily. It takes a long time. He loses a lot of blood. Okay. What could this turn into? This may be more than just one type of shock. Maybe it started out as one, but they add on another type as well. Okay, so keep those kind of things in mind.